I'm Dr. David Bernstein. Welcome back to our series, 25 Tips for Working with Modes. Now, last time we talked about the importance of building mode awareness, and we discussed the fact that we don't want patients just to understand their modes intellectually. We want them to feel their modes. And we talked about the importance of imagery, of using images, in particular the eye modes images, to help them to experience their modes emotionally. Now, today we're going to talk about a similar topic, and that is the use of narratives or storytelling to help patients get in touch with their modes. And that brings us to today's video, Tell It. Now, when patients come to therapy, it's often with an implicit question, and that implicit question is, who am I? Now, patients will sometimes come to therapy for specific symptoms or problems, or maybe they just have a kind of a vague feeling that things aren't right in their lives. They're unhappy, but they don't know why. But underneath that, there's usually a fundamental question of who they are. It's a question of identity. And that question just relates to, the issue of, how did I get to this place? How do I explain, the troubles that I'm having? Where did it all start? How did it develop? Because if I can understand that, if I can understand the story of my life, if I can piece together the story of my life, then maybe I can come to some solutions and find a way forward. Now, when it comes to working with modes, we tell stories in terms of modes. We use modes as the central concept to help people to understand, how they developed, how their problems developed. Because once they can understand, their lives in terms of modes, then things will fall into place and they'll get some clarity. And again, that will help them in their quest to move forward with their lives. So if we're going to tell a story to patients about their modes, the first thing that we can ask ourselves is, who's listening to this story? That may seem like a bit of an odd question to ask, but usually when we provide patients with information, like let's say you did a developmental history and you want to go and feed that back to the patient, so they can have more insight into themselves. Usually this is a process of psychoeducation that's handled in a largely cognitive way. You're trying to provide patients with a kind of rational or intellectual understanding of who they are and how they develop. Now, that's not a bad thing, but in and of itself, it may be missing a whole other level, and that is the emotional side of things. Because in schema therapy, when we talk to patients about themselves, we want to talk to them not only to their heads, but also to their hearts. And so in telling a story, particularly in the early phase of therapy, where we want to help people to start to make some sense of themselves and their lives, we want to always speak simultaneously to two sides of the patient. The healthy adult side, the side of the patient that can take in our information and reflect upon it in a kind of rational or analytic way. And also the emotional side of the patient, which may involve, what we call the vulnerable child modes, the sides of the patient that involve their emotional wounds, their early pain. And early on in therapy, those may be signs that we don't see, that may be hidden away, behind other modes that protect them, like let's say a detached mode. But nevertheless, we know that usually those signs are there. And so what I always try to keep in mind is that there's always, a little child behind the scenes that's listening. So when I'm telling a story about the modes, on the one hand, I'm speaking to the patient's, intellect, to their healthy adult capacity for self-reflection. But at the same time, I'm also speaking to that little child inside. And why is that? Because, it may be that this little child has just been hidden away for so long that, no one has seen that child, or no one even knows that the child is there. And maybe the patient doesn't even know that the child is there. But that little side of the child represents the child's unmet emotional needs. And by telling this story, I always have the conviction that that little child is in some sense listening. And that when that little child hears that somebody knows what's going on, that somebody knows what that child missed and what that child needs, that in and of itself is therapeutic. Now let's take an example of how this process might look. Let's say you have a patient who's coming to you for an anxiety disorder, let's say panic disorder. And I'm just going to, say that this is, for example, a patient who's come to you and she's in her late 20s. She's working in a, artistic profession. She's, has friends. She's well liked at work and well respected at work. And yet at the same time, she experiences significant anxiety in her life. She's recently developed panic symptoms, and she also experiences some social anxiety. And let's say that after spending 3 or 4 sessions, to assess her life history, assess her modes, really taking a full history from her and doing a complete assessment, that we suggest to her that we're going to tell her a story about herself. And you can tell this story if you want just in words, but the way I do it is by accompanying it with the I modes. And as I'm telling the story, I would lay the cards on the table one by one, so that she, in addition to that, hearing the story about herself and her modes, she's also seeing the mode cards and seeing those images and getting the benefit of that extra emotional information that those images provide. And so the story might go something like this. Laura was always a very creative girl. She was very artistic from a young age. She loved to draw. She loved to paint, make sculptures, and make jewelry. And something happened to Laura then when she was 5 years old, and that is that her parents divorced. And that was a big change in her life because, her mother couldn't afford their house anymore, and she had to move to another neighborhood where she didn't know any of the other children and moved to an apartment. And she went to school and she felt quite alone. For one thing, she was, as far as she knew, the only child in her class whose parents had divorced. And again, she didn't know anybody. And because she was also different, she was a creative type, and, she just had a hard time relating to the children around him and maybe around her, and maybe they had a hard time relating to her. And so she developed a couple of sides, a couple of modes. One was an abandoned child side that really had felt, that the loss of her old life. At the same time, that this was going on, her father was very busy making a new life for herself. Her mother was working very hard to support Laura and her brother. And so she was alone a lot of the time. She was alone at home. She felt alone at school. And so she developed a lonely side. And at the same time, she was very sensitive to her mother and everything that her mother was going through. Her father was pretty much absent, but she saw how hard her mother was working. And she vowed to do everything possible to help her mother and to be a responsible kid and a good girl and help her mother out at home, take some of the burden off of her mother. And on the one hand, this reflected a lot of strengths in Laura, her compassion for her mother, her empathy for her mother, but at the same time, it was too much. And she developed a kind of style where, she was very, very focused and sensitive to the needs of other people, tried to comply with their needs, and at the sacrifice of her own needs. Okay, so when people asked her to do things, she would, go the extra mile for them. And even with her friends, sometimes, would do things that were really above and beyond the call of duty. And of course, what was ironic was that no matter how much she did for her friends, inside, those child modes, which she brought with her from her past, still felt that she wasn't good enough and that nobody would ever really care about her without her having to take care of them. Okay, so this is the kind of story that you can tell that helps a person to piece together, the story of their life, piece together the narrative of their life. They may have a feeling for the first time that things make sense, not only on an intellectual level, but also on an emotional level. Now, just to summarize, the important thing here is that, when we use storytelling, we want to tell a story that connects with a patient's head and connects with their heart. It's a way of helping them to become more aware of themselves, about the modes that developed in their lives, and the reasons, the purposes of these modes have served for them, where they came from, And on the one hand, these modes may in some cases, help them, but at the same time, they also may contribute to the problems in their lives. Okay. Now, next time we're going to continue to talk about this topic, about how people can go on a journey of self-discovery and how you can help them to build mode awareness that can help in this process. And that will leave us with our next video for next week. Seek it. And finally, please come to our website, www.imodes.com, and take a look at our image-based therapy tools. Have a great week and see you next time.